Okay, let's start the afternoon session. As you can see, I'm not Rich Schifrin, so we've switched MCs, and what I'll do this afternoon is invite speakers to come and give their presentation. And without further ado, we will continue our discussion of taxonomy of issues and challenges to improving research reproducibility with Lehana Thabane.
Well, thank you so much. And thanks to David and Richard for inviting me to be part of this one. My name is Lehana Thabane, and it's perhaps one of the, it's not so difficult to pronounce, but the funny thing is, I'll tell you a story, because every time I'm invited to either a meeting or even a session like this, and I come in and people look at my name and say, they were expecting a woman. Because my name ends with an A, and most names in the Western culture that end with an A, they're really for a woman. I come from Lesotho. How many people really know where Lesotho is? All right. This is statistically significant. All right. So I thought I should just tell you 3 stories. But before I tell you those 3 stories, they're really related to completeness of reporting of primary studies. And this is really a collaboration between myself and a lot of my colleagues and our students who have helped us to put everything together. So really the credit goes to them. But if there's anything that I say that seems a bit incredulous, please, it has nothing to do with them, it's me. All right. So first I have to say, I do get academic credit for giving presentations like this, which I have to confess, it's part of the problem. And I'll come back to this issue that this academic culture of giving people credit when they give presentations or make publications is part of perhaps what we need to think about in terms of making things better. But I certainly don't have any conflict of interest that I can think of that I wanted to disclose. All right, so I'll give you just a bit of an outline in terms of how this will go. I'll talk about why this is a problem, what the problem really is, and why anybody should really care about it. Briefly go over what the objectives of the 3 stories were that I'll tell you about, and this is about really adherence to the reporting guidelines that really intended to change the situation. And certainly what happens when we look at the abstracts and full reports, what happens when you look at the protocols and so on, and a bit of a story of how this efforts really came about, and have some concluding remarks with the hope that perhaps we can generate discussions on these issues. All right. So really, what is the problem? We're talking about complete. I just wanted to give a context that when we're talking about complete reporting, really looking at the definition in the dictionary says having all the necessary and appropriate parts of that piece of work. And the synonyms really about thorough, entire, total, and you can think of the one that perhaps could apply in your situation. Why is this important? I think we really do have a moral obligation when we've done research to make sure that we report it transparently. Certainly, we would all agree that we have the scientific obligation because science is based on replication. We know that we do one thing in one patient, and then we replicate it in a lot of patients, and we call that a study. And we know that it's not sufficient to do that. We have to actually do it in several other studies to be able to see whether the result holds true in different settings, or if you replicate it. So definitely we do have scientific obligation to do it. We certainly have the economic obligation to make sure that we don't waste resources, because we live in a planet that's really doesn't have limitless resources. And as part of this community of humanity, we have an obligation to make sure that whatever we do it with minimal cost. All right, so how are we doing so far in terms of how we really report research in a way that can make it easier for others to replicate it? We looked at this issue some years back, and what we did at the time, we actually just focused on all those surveys or systematic reviews that were looking at reporting. And then we said, what was the message that was coming out of these efforts? And what we found was not encouraging. So I'll come back to this issue. And then you look at people who also looked at what was happening with abstracts and full reports. The story was not good. The same thing with protocols and so on, people looking at what's in the protocols, what's in the registration, comparing with full reports, the story was still not good. All right. So this led to us to say, all right, maybe we can go back and see how far we've gone, given that there were a lot of reports coming saying we need to improve the situation. And there were a lot of suggestions in almost every paper about how to improve the situation. So we looked at two issues. What's the current state in terms of how people adhere to guidelines? What's the current state in terms of how consistent the information that you see in the abstracts is compared to what's in the full reports? And what's the situation where you look at what's in the registration of trials or in the protocol of trials compared to what's in the full report of those trials? So this is just a story broken into three parts. And you'll see as we go through this, there's a lot of overlap in terms of what the key messages is. So let's start with guidelines. So you remember that the consort, and Isabel was part of this from the beginning. It came out in 1996. And it came out as a result of the frustration that people were having with trying to actually synthesize evidence when the Cochrane collaboration movement was in full swing. The issue was you have all these trials, but they're all providing you with information in a way that's not consistent, so you don't know how to pull the information together. And this was updated in 2010, and since 1996, there's been a flurry of extensions of the consort, focusing on different designs of trials and different types of outcomes for trials and various other variations of trials and so on. And we've recently, just wanted to bring it to your attention, actually been working on the consort extension to pilot trials, which came out last year. And the issue also was trying to see whether we can actually improve the reporting of pilot trials, which are incredibly essential when you're trying to inform design of larger studies. If you look at the equator, somebody has already mentioned this earlier on, that there's a lot more that has been done, not only in trials, but in all other types of designs and research that we do. The issue is all aimed at improving transparency. So we thought, why don't we just update our scope and review and see how far we've gone in how people adhere to these guidelines in their reporting. So we focus primarily on all the surveys that were looking at whether a particular guideline was being adhered to in a particular research area. And we looked at all the guidelines we could find, at least those that were looked at in surveys and so on. And as long as they were written in English and we could read them, then we'll include them. And what did we find? There were about 124 of them, and 65% of them actually focused on adherence to the consort statement or variations of the consort statement, and about 15% was PRISMA and so on. So definitely people have been looking at this, and the message is still the same. Earlier on, when you looked at it, there was about 86%. Now it's 88%. All saying it's either inadequate, they're using words like it's suboptimal, it's deficient, but the one thing is for sure, they're saying there's room for improvement. So definitely you can see that the message, and the issue was that people are looking at what are the factors that are behind this inadequate reporting or poor reporting and so on. The one thing that was good and consistent was that there's areas where we can actually focus our efforts. Some of those efforts could be really trying to encourage journals to endorse the guidelines because it was a consistent factor behind why people were not doing a good job. If journals didn't endorse the consort, reporting in those journals was generally not good. But even in areas that do, the problem is there's no enforcement of making sure that authors provide the checklist at the time of submission. That's a problem. So certainly this is something that can be done. But it was funny because reporting ethics approval actually turned out to be a good thing. So we now know a lot of research ethics don't just look at the ethics without looking at the quality of the protocols that they have to review, because now they have the expertise in most RABs. Certainly, I think you can see that there's room for improvement, and these are things that are within our ability to be able to deal with. Of course, there's other non-modifiable issues that are, journal issues and study issues about quality and so on. that we can't do anything about. So we had recommendations then, and I thought, well, I can just put the same recommendation. As you can see, somebody said that we need to do more education, but of course the onus really lies more on the authors, who are the researchers, making sure that these things are done much better. But certainly editorial policies could also be improved to try and make it easier. I'll revisit these issues in the end because I think they're absolutely essential. So really the take-home message is that the adherence is still not adequate. There's room for improvement because there's things that we can actually change. We just have to be deliberate and systematic in how we do it. All right, what about abstracts and full reports? Now, when you think about it, an abstract is a summary. It provides you really a good, concise information about the purpose of the study, the methods, the results, and what the key message is from that study. And you can decide based on the abstract whether this is worth reading further, or you're just going to, perhaps cut your losses. But in many areas, really, that's the only thing that people rely on. And they may have to make hard decisions based on the abstract because they don't have the resources to actually access the full paper. So abstracts remain to be some of the important sources of the information we do. But we know that even though the concept as one of the bodies that have tried to address these issues, they have the consort extension to abstracts, the information coming out is still consistency in that, hey, people don't adhere to this stuff. So we wanted to look at whether there's a way we can figure out how to improve the situation. What do people say, those who have looked at it? So we looked at surveys or systematic reviews that were looking at whether the information that's reported in an abstract is similar to the information that's reported in the main text. What did we find? 17 studies looking at this. 3 of them were looking at information in the abstracts of systematic reviews and full report of that review. Others were looking at what's happening in the main studies and looking at what's happening in the abstract and so on, and they're focusing on different areas. But the message was very simple. If you look at all the words they use, inconsistency, deficient, inaccurate, discrepant, some are even thinking there may be deliberate spinning of the results and so on. So I think you can see that the situation is not different from what we see with adherence. And certainly, inconsistency about 39%, looking at the median, it was variable across different studies. But major inconsistencies about 19%. And we're using the word major here because that's what the authors came to that conclusion, that these were major deficiencies. And there were various other types of inconsistencies and so on that you could look at. Now, what was the main factor found in the different studies? It turned out it was a single factor. The longer time it takes for those abstracts that were actually in conferences to the publication of the main study, that was found to be a main factor behind the differences. Now, people think there's a reason behind this. So people write abstracts for conferences. Sometimes they're based on preliminary results. And then when they come back from the conference, they update the analysis, the data set is updated, and they no longer actually update the abstract. They actually do the whole paper, get their collaborators to review the paper, and then just before they submit, they realize, oh, we didn't do the abstract. They take the abstract that was submitted to the meeting, and actually that's what they use in the paper, hence some of these discrepancies that you see. So it means there's really room for improvement if we are aware of what the problem is. Certainly the take-home message is that there's variable level of inconsistency between the two sources of information, and for those that are actually coming from conferences, the time it takes to publication may actually be responsible. There was a trial, actually, I was surprised, trying to actually change the situation. And it was providing specific instructions to authors to be able to actually change this. But unfortunately, they didn't find any difference in looking at this as a trial. So I don't know whether it was the issue of the trial or it was the issue of the outcome, whichever way, but at least there was an attempt. What about protocols and registration? Now, this is a bit of a tragedy as far as I'm concerned. Now, you'll remember that in 1997, so the FDA Modernization Act was intended to really get, cancer trials registered. It was mostly, breast cancer trials and so on. And then this was actually amended to include all trials in 2007. And they came up with really criteria for registration of these trials. About the same time, that's when the International Committee of Medical Journal Editors decided, well, you know what? We will not publish any trial unless it has been registered. And the WHO joined forces, and certainly they tried to see how they can improve this. This was also based on really a call from many other countries saying that we need to find a way to make sure that the information from trials is accessible to everybody. And therefore, they created this voluntary research registry platform, which now everybody can use. Now, the thing is now with wide acceptance of trial registration, which has never been an issue, many journals started really establishing editorial policy to publish protocols. Before this, I don't think there was much issue about that. BMJ now, they made a policy in 2005 that when people submit their trials, they will require submission of the protocol at the same time. They will not publish the protocol, but they'll review it as part of reviewing the manuscript. But the Lancet went a step further. They said, well, we would actually not only review the protocol at the time when we review the manuscript, would actually link the manuscript to the publication of the protocol. We'll make sure that people can have access to it. And certainly, JAMA and New England Journal of Medicine, they require protocols as part of the submission process. I'm not sure whether they actually get them published or linked to the publication of the protocol, but certainly they do require them. So I think it was during this time that a lot of journals started actually looking at ways they could actually make sure that protocols now are accessible to readers. And they started actually having editorial policies that says, we do actually accept protocols. And you see a lot of protocols now being published in open access, even in print journals. It has been really an accepted practice overall. So we then said, all right, there are studies that are already looking at, okay, so there's registration, everybody's accepted it. Publication of protocols, everybody has accepted it. I need to make sure that I check the light here so that I can know when I'm over time. So now what we wanted to look at is say, all right, with publication of protocols and registration, people are saying this is what we plan to do. Now, people are looking at, all right, did you do what you planned to do? At least you made it public. So we looked at all reviews or surveys that were comparing information that was either in the registration or in a published protocol to see whether this information was similar to what was in the final published manuscript. We found 37 such reports, and 4 of them were systematic reviews, 33 were surveys, and 36 of them were focusing on randomized controlled trials, and 1 was actually a combination of randomized controlled trials and observational studies. For those that were focusing on registries, they were looking at registrations in clinicaltrials.gov. There were 13 studies, and the other 2 were from the WHO registration and the International Standard of Randomized Controlled Trial Registry. All right, so 13 focused on several areas, and they also focused on measuring comparisons between outcomes, the subgroups, whether the subgroups that were in the protocol or in the registry were also reported, whether the statistical analysis that were in the protocol were actually used in the final analysis, whether the sample sizes were the same, whether the inclusion-exclusion criteria were the same, whether the randomization information was the same, or even whether the funders as reported in the protocol or in the registry was the same. And many of this were actually conducted in North America and in Europe, with sample sizes varying from 16 to over 400. What did we find? They said there's problems. There's a lot of selective reporting, and I think somebody has already mentioned this issue earlier on. There's a lot of discrepant results between these documents, inconsistent, biased reporting, and as you can see that really the situation doesn't look good, right? And we looked at outcome reporting. 17 studies focused on this issue, and overall, it is variable. It's all over the place. The reason why earlier on I said it's a bit of a tragic is because if people can't even worry about doing something that's different from what they said publicly that they're going to do, and there's documentation to that effect, and they know very well that the readers or the reviewers and the editors will actually go back to that document, I think there's a bit of a problem. So I think we need to find ways as to why are people not doing what they said they were going to do, despite knowing that people will be looking at it. All right, subgroup analysis. There were 3 studies focusing on this, and in some cases, there were either new subgroups or subgroups that were changed. Some of them were post hoc, they were never in the protocol and so on. Even those that were pre-specified, some of them actually didn't do the ones that were pre-specified without providing a rationale for why they were not done. Now, statistical analysis reporting, in some cases, the methods used to actually do statistical analysis were different from the methods that were in the protocols. And there were other things about multiple comparisons and so on, and you can see really the prevalence of these problems were all over the place. What were the factors behind this? Statistically significant results. I think Kay showed this earlier on. Was that Kay? Yes. That really, this was one of the drivers. And funny enough, sponsorship. You'd be surprised to know actually industry-sponsored studies do better. So, which means we academics, we need to do a much better job because industry-sponsored studies actually do by far much better. And type of outcome, depending on whether it's an effectiveness outcome or an outcome of benefit or harm, that's different. You can see why that may actually be viewed as deliberate discrepancy. And this is disease specialty, and what I see in my take to this was that many of those specialties that did better, they are those that are actually very good at collaborations. They collaborate with methodologists, and this has been the practice in the area, and you can see the difference. Overall, really, you can see that the message is very clear that there's variable levels of inconsistencies, and there's areas where we can improve because this provides opportunities for us. All right, so what can we do with this? Remember again, I said, definitely looking at the 3 issues. The message is the same, and there's still areas for improvement. So you'll probably remember this paper, and I thought I should actually bring it up because it's perhaps one of the papers that was challenging us to actually think about how we approach research and whether we, as a think tank of our society, we are doing a much better job in doing this. And he said you could actually tell whether the finding is false or is true. And there's various factors that can help to tell. Unfortunately, we can't unless we report all the studies and we report all the information that we're supposed to be reporting. So I think really trying to do whatever we can to make sure that we try to encourage people to report everything, whether it's the author themselves, the general editorial policies will definitely need to change. Remember that complete reporting is transparent reporting, and it certainly builds public trust and credibility of science, and including really saving resources because we're always struggling for resources. We don't need to be doing research where we don't need to do it because there's been enough replication and the answer is definitely out there. All right, definitely we've made a long way since 1996. So I don't want people living here thinking that the situation is so bad we haven't even made improvements with all these guidelines. We definitely have. We certainly have, but there's certainly room for improvement, and I think people still have to be hopeful because a lot of what we see about factors behind this are things that are within our reach. I'm a bit embarrassed to actually be advertising somebody else's book, but it's actually worth it because I think this is one of the textbooks that should be part of any course that's teaching about clinical research, clinical trials. because it's not enough for us to teach them how to do it. We certainly have to re-emphasize the efforts about how to report it. And it certainly covers the basic principles of how to actually do this in a way that's going to be very helpful. But I thought there would be a few things for us to consider. Endorsement of guidelines, I think, is within the realm of every journal editor to actually endorse the guidelines. Right? Because consistently the message has been from all the studies that just endorsement of the guideline, it's enough. It forces the authors to make sure that they check the guideline before they submit. And certainly making sure that you don't accept reviewing the paper before they submit the checklist as part of the submission. That's not hard to do. You can make it such that the submission will not be complete unless they submit the checklist. So this can be programmed within the submission software for this to happen. But that's for the guidelines. What about abstracts and what's in the complete report? My sense is we need to produce another checklist for authors to use and say, all right, this is what you have in your abstract. It's a structured abstract. Do you have the same thing in the main report? They should submit that as part of the checklist. And the same thing, this is what you said you're going to do in the protocol. Did you do the same thing in there? And that provides them with an opportunity to actually explain why they didn't do that. So I think some mechanism to actually make this happen need to be put in place. I certainly think we need more training. I'm putting training, because we don't only need to train students. We need to train reviewers. We certainly need to train journal editors. Because just because somebody did research, just because they tried to report it well, doesn't mean it'll be published. Journal editors and publishers still reject good work because it's not what's going to sell for their journal. So I think there still needs to be a way to actually encourage publishers to be a little bit more open-minded about publishing every work. Science is really for advancing knowledge for the welfare and health of society. It is very much dependent on replication. And interdisciplinary collaboration is one way to actually do this. And you can see that in many, many areas where people really collaborate with methodologists. There's definitely been improvement in this area. Sure, look, doesn't mean that we're not going to make mistakes. We're human. We will make errors. We will have omissions. Many, many times I've checked something and checked it over, and sometimes after it gets published, I still find the error, which was so obvious, but none of us picked it up. So we'll still make mistakes. That's just because we're human, right? So we need to think about really, for me, in some of the cases where there has been a deliberate error. And I think the culture that we have in terms of how we promote people, how we evaluate people for various things in our academic culture, is part of the problem in encouraging behaviors that are really not helpful. They are counterproductive when it comes to science. So I think these are some of the things for us to really think about. If perhaps one of the things that could come out of this is to be able to actually change the culture. It's really never late. Look, the institutions are what we want them to be. We are the ones running these institutions, and we can change them if we want to change them. But we have to be determined to actually change them. Not to say that it's going to be easy, but certainly we can make a lot of changes where we think changes are really needed. I'll leave it here. I think I still have enough time for us to have open discussions and say thank you to all of you.